Stigma, discrimination, poverty, poor access to quality healthcare. These are some of the problems people with disabilities face in Nigeria. But all hope is not lost, as some non-governmental organizations are now educating persons with disabilities on their rights, as well as enabling them with free medical treatment to improve their health. Inoluwa Popola reports, and after this report, we have business stories for you.
About 1.3 billion people experience significant disability worldwide, making the living conditions and accessibility to healthcare more difficult. Michael is a person with disability, but more importantly, an athlete who has not allowed the healthcare system affect his passion. Truly, to every disability, there is an ability. He says the government needs to do more in ensuring there is total inclusion of persons with disabilities.
To healthcare for persons living with disability in Nigeria is not that accessible. In Lagos, some parts, yes, they put into consideration of persons living with disability when it comes to their constructions of hospitals and all that. Generally in Nigeria, we are still lacking behind when it comes to access to healthcare for persons with disability.
To celebrate the International Day of Persons with Disabilities, advocates from various NGOs are sensitizing the disabled on their rights, as well as giving them free medical treatment.
Nigeria has a community who are still fighting, who are still trying to ensure that we understand the policies that are even available. That is why it is important to even educate the community, the people, about even the policies that protect them.
One thing I always preach is openness. Let persons or medical personnel be very open to understand persons with disability. More or less like having a disability etiquette. How would they want to treat persons with disability?
How much budget are you budgeting for healthcare? We had an Abuja convention that says we should be 15%. We are still at 80% in Nigeria. And how are these budgets implemented? What is the focus of the implementation? Who are those monitoring the implementation? So sometimes you give 9% of budget to healthcare, but nobody's monitoring it, so we're not even sure if the budget is actually going to where they should go to.
As Nigeria races to achieve universal health coverage as part of the SDG goals by 2030, these advocates are calling on individuals, medical professionals, and government to help eradicate discrimination and inequality among persons with disabilities. Inoluwa Popola, TVC News, Lagos.